Reproductive health is a basic human right, and although progress has been made, a lack of government funding still hinders effective implementation of sexual reproductive health rights programs. The Regional Psychosocial Support Initiative Country Representative Simone Shihepo Mulamata says harmful cultural practices are not helping the situation as they expose young people to infectious diseases and early pregnancies. She said although the root causes have been identified, more needs to be done, and how it is currently being addressed. Although the root causes have been identified, more needs to be done.
You will find that, especially in the case of Namibia, for example, there's always been a focus on issues as they emerged. For example, HIV/AIDS became a huge problem. Policy and development focused on HIV/AIDS. TB/HIV/AIDS became a problem. Policy and development were directed towards that. When COVID-19 became a problem, policy and development focused on that. So, and in most cases, we work on the fruit instead of the roots. And that, I think, not enough has been done to explore root causes of all this.
Despite the fact that young people are aware of their rights, Mulamata noted that there are behavioral problems caused by peer pressure, societal perceptions, and social media. Additionally, research should also strike a balance between the rights and the health issue while not excluding norms and values, perceptions, and mindset. Young boys also need to be taught about issues of masculinity in the area of sexual reproductive health rights.
We're also working with boys because when we talk of adolescent mothers, and just to give you an example, in one of our schools in the Kunene region where we are working, we have a number of 56 learners that are adolescent mothers. They are in grade 11 and they are in school. Now, these learners were impregnated by a man or a boy. And that is why we need to teach boys masculinity. And that is one gap, huge gap, an area for research, like you've asked earlier, in the field of sexual and reproductive health and rights.
The Regional Psychosocial Support Initiative has adopted a hybrid program service delivery approach, including continued and deeper focus on mental health, education and protection and sustainable livelihoods. This will also promote psychosocial support and strengthen national and community systems for prevention as well as response to violence against women and girls, baby dumping, and children in conflict with the law, amongst others. Siamanthikwa, NBC News, Windhoek.